This morning, Wednesday, May 6th, the State Department of Health reported that COVID-19 cases in Miami-Dade County surpassed 13,000, and 432 people in our county have succumbed to the virus. That means that 33% of all of Florida's COVID cases are in our county, and nearly 1/3 of the deaths are here as well. So we remain the state's hotspot by far. There have been lots of emails from residents who have asked us for a clearer explanation of how the city will make decisions regarding opening of our businesses. So first, you should know that the city manager and our commission are informing our decisions with the very best medical advice. Our team includes local, state, and national infectious disease professionals. Dr. Ratson is the chair of infectious diseases at Mount Sinai Hospital. Dr. Marty is advising the county, and Dr. Villalta manages the county health department. Dr. Morris leads the Emerging Pathogen Institute in Gainesville, Florida, and his team have spent lifetimes on the exact issues we are confronting. Dr. Woods directs Duke's Global Health Institute, where he is professor of infectious diseases. And Dr. Shukla is a UM doc who is the director of infection control at the VA Medical Center. These and others are regularly consulting with us and reviewing every action that we take. So here are the factors we need to consider and the benchmarks we need to meet to reopen. The first element we will need is some observable proof that the virus has sloped downward such that it is manageable. The CDC recommends looking at a 14-day period to see if COVID-related data is indeed dropping. Now, as you can see from these charts, while we are clearly past the peak and headed mostly in the right direction when it comes to new COVID cases and testing results, we are not at the point yet where we are consistently mapping downward. In fact, the daily hospitalizations from COVID have recently increased. Still, I think that we may soon show a uniform downward trajectory. Once we do, then the next factor becomes critical. The second factor, and perhaps the most important one to get right, is the development of a robust and properly staffed surveillance testing and contact tracing system that will allow us to manage the virus that remains and that returns. The surveillance tests allow you to determine the presence of the virus in the community generally, so we are not caught flat-footed. The contact tracing program, which requires hundreds of investigators, actually tracks down the contacts of people who are infected. This allows us to control any outbreaks which may occur without requiring us to close everything down again. While we are not there yet either, we are increasing our testing and tracing capacities. I'm very pleased to announce that Friday, we will be opening up our convention center as a COVID-19 testing site for both drive-through and walk-up. No appointments are required, and the site will be open daily from 9 a.m. to 5 p.m. More information is available on our website. Additionally, the Rockefeller Foundation has designated our community as one of only 10 in the nation to receive expertise and resources to help us elevate our testing and contact tracing efforts. Now, the third factor is the ability to practice proper social distancing, which for us may be challenging. Unlike many other communities, our city is a magnet for visitors. Typically, that's what we are built for and embrace, but that won't work in a pandemic where maintaining social distancing is vital. And the CDC guidelines require social distancing for nearly all of the phases of reopening. Here is Professor Morris, the doctor who directs the Emerging Pathogens Institute in Gainesville, explaining this challenge in our community.
Your actual population who live on the beach is not that high. We're probably talking 100,000 individuals. What's really unusual is the large influx of people who come onto the island. And so this is different than if you're sort of, well, for example, like Gainesville. Gainesville has a population of about 150,000 here at, where UF is located. But that's a fairly stable population, except of course for our students. And so every time you have a major difference. And in your case, it's this huge influx of people, both from Miami Beach, other parts of the United States, as well as internationally. It does mean that some of the standard procedures that one might use in a smaller closed community are going to need to be modified or thought about in a somewhat different way.
So we can't just blindly follow the template used by other places. Finally, the fourth factor. It's that our healthcare system must be able to address our potential challenges without overwhelming our hospitals. Hospitals in our county have demonstrated that they are able to do that and, in fact, have reduced their occupancy substantially at great financial cost to make room for any surge of patients. Fortunately, that surge didn't come, which is why this criteria seems to be satisfied. Everyone asks when these benchmarks will be met. The answer is we don't know. While I think that the virus is subsiding and we are clearly developing enhanced capacity with regard to testing and contact tracing, I am not convinced that it will be easy to fully open up those elements of our city that attract thousands, often hundreds of thousands of visitors, until the requirements for social distancing have been lessened. And that is our quandary. How do we open up industries that rely on and attract crowds when crowds are not what we should want right now? For instance, I am receiving many requests from people asking to open our beaches, and I understand why. But when we do open them, they will be teeming with people from our city and from all over the county and region, and perhaps from elsewhere. Here is Professor Morris addressing this issue.
I think the major concern with reopening the beaches, as I think California and other places have found, is that it brings in large crowds of people. It's not so much the beach itself, it's more that, it significantly enhances the number of people who are coming to your beaches. And again, in your case, the number of people dropping in from New York and a variety of other places coming to take a look, coming down to be on the beach. Those crowds are going to significantly enhance the risk. And so before the beach is open, you need to be really confident that you've got in place appropriate testing and tracing, appropriate protocols for benchmarks for what you're going to do when you find somebody who's infected, who's staying in a hotel room. So there's work that needs to be done, I think, before I would feel comfortable saying, bring on the crowds. And I would see it more, not so much as opening the beaches, but more, that's going to substantially enhance the number of people coming into the city.
So yes, we're not fully ready, and we will likely have some challenges when we are, but we have had significant movement in the right direction. Finally, I wanted to talk about our efforts to comply with all the guidelines. The frustration is understandable, but it is so important that we try to adhere to these instructions. Every one of them comes from doctors and health professionals who have told us this is the way to reduce the spread of the disease and to save lives. When we imposed a requirement for wearing masks in certain public settings, it wasn't arbitrary. It was the recommendation of experts in the CDC. Same with closing the beach. While nearly everyone, even those in disagreement, are generally courteous, a few are not. Yelling or cursing at city workers who are putting themselves at risk and are just doing their job is really unacceptable. The city isn't going to begin arresting people for not wearing masks or violating social distancing rules, but we need you to please follow these procedures, even if you disagree with them. Are we positive that everything we are doing is just what needs to be done? No, of course not. And it's not difficult to go online and find articles and opinions saying we should do nothing or that some measure or some other measure is unnecessary. But we can't pick the path we like because it's easier. What we are doing is based on recommendations from the best experts available. So we need to stay the course. As always, thanks for your patience and calm. Stay healthy and at home.